New Haven health system, and he's been in that position for a little over 3 years. Prior to this position, he was the president and the CEO of St. Raphael's healthcare system and the Hospital of St. Raphael. And he served in that position until the successful affiliation with Yale New Haven Hospital in September 2012. He was at the forefront of merging those two partnerships, St. Raphael's with Yale New Haven, which I think has been a huge success. Chris O'Connor was also president of Caritas Christi Healthcare, the 340-bed flagship of the 6-hospital system affiliated with the Archdiocese of Boston and Tufts School of Medicine. Mr. O'Connor served as Vice President of Clinical Operations for the Ochsner Health System in New Orleans. It includes 7 hospitals and 35-plus healthcare centers. He was the senior leader responsible for Ochsner's response and operations during and after Hurricane Katrina. It was one of only 3 hospitals that remained functional. I think that was a really big thing in his life. Mr. O'Connor is a fellow of the American College of Healthcare Executive. He received his master's in healthcare administration from George Washington University in 1996 and his Bachelor of Arts from George Washington.
I don't know who this is.
Above all, he is a great loyal member of the New Haven community. He lived and attended New Haven public schools. And I just wanted to say this. For me personally, I have known Chris O'Connor since he was a young kid playing hockey with my son at Ingalls Rink in New Haven. And it is with great pride and I think love that I welcome him today to speak to you about the state of hospitals and the relationship of hospitals to seniors. Christopher O'Connor.
All right, I have to figure out how to do this from a physics perspective. One mic is for the camera and one mic is for the speakers. So we'll see if I can do 2 things at once, and being a man, that's highly unlikely. So I really do have no idea who you were speaking of in that intro. Why it's so long and verbose, I don't know, and apologize profusely. So I'm actually really thrilled to be here. There's a lot to be proud of when you think of what's going on in our local community. And for somebody who was born and raised in New Haven, and you step back and think about the facilities and access to high-quality healthcare that we have, we really are in a very fortunate position relative to many, many others across our country who don't have nearly the access and expertise in their backyard. So I'm going to talk a little bit about that. I think that the opportunity to sit in front and talk about what is going on and to instill that there is an enormous amount happening in our backyard, both at the Yale School of Medicine and certainly at Yale New Haven Hospital and within our health system. I stand here with a great deal of pride. And while healthcare is by no means perfect, and if we do have a Q&A period, inevitably it will open up with a billing question. And anybody have a billing question? So the CFO will be in the other room. You can go talk to him. But we really have advanced so far. So I was born, as Bernie said, I was born at Yale New Haven Hospital in New Haven. But my whole life I spent in the St. Raphael's Hospital family. My mom was a nurse there for a few years. I won't say how many, Mom. She's in the audience. That's the only reason. Otherwise, I'd blurt it out in a second. But I remember the first opportunity that I had to be exposed to healthcare was when I was a sophomore in college. I started to work in the emergency department at St. Raphael's as an emergency room technician. And I grew up in, a family. My father was a lawyer and my mom a nurse, so it was, I had a lot of privilege. I was very fortunate in so many ways. I played hockey. in New Haven, which was also a privilege. So I went in, like I did with every job before I started at 19 years old in St. Raphael's. I went in what you get dressed to go and, when you're in college to work. Khakis, the State Farm outfit. Khakis and a blue button down. So I walk into the St. Raphael's emergency department, and the nurse manager at the time, Karen Galvin, said to me, "Oh, that won't work. Blood, khakis, and button downs just usually don't mix well." So I'm not a small gentleman. I was fed well growing up, and so they gave me these pair of blue paper scrubs. So my very first day in healthcare, it's a wonder why I'm still in this industry, frankly. I go and I have the opportunity to perform my first CPR on a patient who was coming into our emergency department. I'm a big guy. I sweat. Sweating in blue paper scrubs. Not flattering. It is a wonder why I didn't just turn and run that day. And what I fell in love with about healthcare on that same day that I looked like a fool in my clothes was the teamwork and the purpose. We step back and we talk about healthcare in this country, and there's been a lot of public debate about it. But I will tell you, there's never a more prideful moment than when you're in an emergency department or in a tough crisis situation, and you are flanked by some of the smartest people in the world, and you're all working for one purpose. I mean, you break away, whether you're a technician, whether you're a nurse, whether you're a physician, whether you're the dietary worker, whether you're a housekeeper, it doesn't matter. Everybody there is for the same purpose. And I think when you start to think about what we're doing and how we're performing, we get sucked into this vortex, and I'm glad Senator Kennedy left, so this is my political portion of the program. You get sucked into this vortex about payment and politics and size. So one of the things I thought I'd start with is level setting who Yale New Haven is. Because if you live in New Haven, you think Yale New Haven that's it. It's all of healthcare between the merger with St. Raphael's. But in fact, while St. Raphael's and Yale New Haven, when they combined, made up, I think at the time it was the 5th largest hospital in the country. Big place, 1,500 plus beds, a little over $2 billion in net revenue just in the New Haven area. But we only have 2 other hospitals, Bridgeport and Greenwich. Combined, we have a total of $3.5 billion in net revenue. Seems like a lot, right? We're I think the 3rd largest employer in the state. But when you think of the size of Yale New Haven relative to other large healthcare systems in the country, we're about 50. So when you think, while there's a lot of criticism lately around how big Yale New Haven is getting and the concern, and many of you may have read in the paper that the governor put forward an executive order that is holding up our potential affiliation with Lawrence and Memorial, we're relatively small. And if you go back to the premise around the Obamacare, and whether you're for it or against it, the reality is what it said is something that I think we have to do regardless of what party's in power and what happens going forward. We have to collaborate and coordinate care far more effectively than we've done in the past. So we have been very episodic in our approach to healthcare. You come in, you break your hip, you get your surgery, we discharge you to either home or an extended care facility, rehab in that case, and then we're kind of done with you. And what we said is that that's not good enough anymore, because now we have to make sure that you're going to the best care. Doesn't matter whether it's an extended care facility or home. We have to make sure that you're not going to be coming back to the hospital, that you're going to get the home care that you need, that you're not going to get an infection. All of those things now have taken on a different responsibility. We in the hospital now, our payments have changed and they're at risk for those types of complications. And I think that's positive because it's put a greater responsibility on what we do. There is no doubt that right now we are paid for everything that we do. That needs to change. And one of the transitions that is underfoot right now is a transition to what we call a value-based system. And a value-based system is really, the premise of it is that we are not going to be paid for what we do, but how we do it. And we've actually seen some great examples of this. At Yale New Haven, we're participating in what we call a joint replacement bundle. So if you get a knee replacement or your hip replaced for elective, not a fall or something that would be traumatic, we now are paid a global fee. So between the doctor's fees, the hospital's fees, anything that happens post-hospital, there is a global fee that we're paid. Why is that important? It may not matter to you. It doesn't change the way that you receive your care whatsoever. But what it does is it ensures that we're trying to do the best for you the first time that you receive the care. And I don't think, it's not that we weren't doing that previously. It's just sometimes our payment incentives were misaligned and that we were actually paid for when you got an infection. And again, nobody, I can guarantee you this, nobody in healthcare would go about trying to infect anybody, but the reality is that the practices, I think, were not, the incentives were not aligned. And now at least that alignment begins to push the conversation around responsibility and accountability. And you can talk about things. This is actually happening in oncology. So we have built one of now the nation's leading cancer centers. Smile Cancer Center 10 years ago didn't exist. And now it's in the top 30 of cancer programs across the country. It has grown tremendously. We used to send out over 10% of our oncology patients out of state. Now that's down to 1%. And a large part of those are going into the Smile Cancer Network. That investment, which has been substantial, obviously everybody has seen the Smile Cancer Hospital, but beyond that, the research, the bench researchers that we've been able to recruit under the Yale Cancer Center, the clinicians that have built robust specialty programs around our oncology programs have really changed tremendously over the course of the 10-year program that we've invested in Smilo. Why is that important? Because now you can gain access to the latest care right here in New Haven. You have the best facilities that are available to you right in New Haven. It's not going to Boston or New York. You can do it right here in New Haven. And I, like you, probably have the unfortunate opportunity to go visit a number of friends and family that are patients in Smilo. And the experience that you have when you go there is completely different than the fragmented care and going on an oncology floor of the past. It's integrated care. You have the Hope Garden. I mean, there are things out there that we didn't have the facilities or capability to do in the old world. And now we have been able to put those resources together and move forward. And I think that when you sit back and you say, what's going to happen in healthcare in the future, and God knows nobody in this room is going to need it, so that's a good thing. But if you have a friend or a relative that needs healthcare, we're actually in a better position than we've ever been to care for you. At Yale New Haven, we invested over $300 million in an electronic health record. Now, that's a lot of money, right? It's an expensive program. But what we've been able to do by investing those dollars is share information across platforms. So now and it doesn't even matter if you're on Epic, which is the health record that we've installed. Every clinician, and it doesn't matter what anybody says, I'm telling you here, guarantee you, every clinician in this state has access to the clinical data for any patient who has received care in Epic. Now, that is an enormously powerful tool. If you lived I will go back to when I was 19 years old and started in the emergency department, we had big paper charts. You tell me who has access to that chart. Well, usually it was the intern or the resident that was scouring it, trying to figure out what they were going to do. But now, everybody can access it simultaneously. I mean, these are real advances when you think of the progression and the opportunities that are in front of us to advance care. Sometimes it's the subtle things. It's knowing when you last got that CT scan, knowing what your last inputs and outputs have been. I mean, those are what feels like minor pieces of information that wound up translating into better care with tools that we enable our caregivers to have at their fingertips. And I think that when you think about healthcare and the financing mechanisms and the insurance industry, I think we get a little bit lost in what happened. Not that we shouldn't or can't deal with that, because we can clearly do better on that side. But what I think we lose focus on is the enormous value that our caregivers are providing on an everyday basis. Senator Kennedy said the right thing. He was saying it from outside of the healthcare arena. I'm going to talk about inside of it. I mean, our nurses, our physicians, I mean, the pressures that are on these folks on a daily basis are tremendous. And what we need to do is to continue to support their efforts. That's my job as an administrator. Not a popular one on most days, but the reality is that we still have lots of opportunities to be more efficient and more effective in the care that we deliver. And right here in New Haven, we're able to do that, and because we've had the opportunity and the fortune to have a healthy bottom line, we've been able to reinvest. We're criticized often sometimes from the margins that we produce. And I will tell you, every single dollar of those margins go back into the investment in our facilities and the care that we provide. We invest on a regular annual basis, over $100 million in just program development. So, and back when I talked about the Smile Cancer Program, hundreds of millions of dollars were needed to seed that program, not just from the bricks and mortar of the Smile Cancer Hospital, but I'm talking about building the clinical programs that now are occupying those facilities. That doesn't start with, a negative margin. And I can tell you, when I was at St. Raphael's, that was the biggest challenge. We didn't have the dollars to reinvest in the care. And right now, this is unfortunately, we have a very high-intensity capital industry in healthcare. Every device that we touch, you've gone to the hospital, those devices, if anybody has had the experience of seeing what a hip or a knee costs, that's not what we're getting paid for it. That's what it actually costs us to pay the vendor to get the device. I talked about Epic. I've talked about the facilities. All of those things are just high dollar items that continue to eat up that balance sheet that we have. But without it, we wouldn't be able to stand here and talk about the advances that we've had. There was a story that we told at our board meeting a few weeks ago, and it was a story. So we have a major project, because one of the key things that we have to do is we know we have to reduce costs. As an academic medical center in this country, we know that our cost base is too high. We're going to be higher than a community hospital. If you were to compare Griffin Hospital to Yale New Haven Hospital, there's no way we could compete on a cost basis. Why is that? Well, I talked about the research that we have that Griffin doesn't have. We're affiliated with the Yale School of Medicine. We have the fortune to produce Nobel laureates from that program that are, really innovating and discovering new methods and treatments. That has dollars associated with it. We also teach. We have, one of the largest teaching programs at Yale New Haven Hospital in the country. Teaching is an investment. It's an investment in the clinicians going forward. All of those things take resources. So we've been working very hard on reducing other costs. And one of the biggest costs that we have is variation. And so the story that was told was in our NICU, when we have drug-addicted babies born into the hospital. When you looked across our network, there were multiple methods of treating those babies. Again, it's hard not for your heart to melt when you think of these stories and the patients involved. Long lengths of stay. They're staying in the neonatal intensive care units for a long period of time. They're getting different treatments. It's costing significant resources when you do that. Our clinicians were able to come together across our system, so at Greenwich, Bridgeport, and New Haven, come together, talk about what the best protocol is, try different therapies, and ultimately move the length of stay from over 17 days down to 6. I mean, and the babies are going out healthier, happier, the parents are. I mean, these are stories that happen on a daily basis within the health system. But maybe it's because we don't tell our story loudly enough. But there are so many innovations and advances that are happening within our healthcare system. And not just at Yale New Haven. I'm talking about also at Bridgeport and Greenwich that are also doing some fabulous things. So we have a lot to be proud of. There are a number of programs that we continue to see. We're going to be really launching a new musculoskeletal program, which will be really innovative. Typically now, musculoskeletal is based upon orthopedics and surgery. We're going to try and do a non-surgical route. How do we keep people out of the operating room and healthier before they need the hip or knee replacement? So that's one of the things that we're really embarking upon next. And I think you're going to see continued advances along those fronts. And the goal is to keep you home. And I think that's why working at Yale New Haven, I think aligns very closely to the missions that we're here to support today. So with that, I'm going to close my remarks.